Breast cancer impacts 1 out of every 8 women. Think about that. That's a significant amount of the population out there. Men are not immune from breast cancer diagnoses either. It's something that's hit my house. My wife being diagnosed with breast cancer at the beginning of the pandemic. It's been a lot to have to deal with. And a lot of other individuals out there dealing with similar things, but there is help. And there's importance to getting early detection in. Megan's not even 40 years old and having to deal with the diagnosis. And it's one of those things that just compounds on you. But having the proper support and the knowledge that you got to it before it was too late, that can work wonders. To talk more about this is Dr. Emory. She is Chief Medical Officer at Aetna Better Health of Illinois. To really kind of give us the latest when it comes to early detection, the importance of it, and also her personal story about dealing with breast cancer. Doctor, thanks for taking time with us this morning. How you doing out there?
Sure. Good morning. I'm doing well, thank you. And I'm sorry to hear about your wife.
She's doing fantastic, and I tell you, it's the early detection that means everything. And it's actually something that I myself, I felt on her breast and was like, that doesn't feel right. It was right before the lockdowns, and something that she took it upon herself, and I'm so thankful that even though people were told to stay home, she didn't. She went in, got that diagnosis, and marched forward. And we're happy to report she's doing fantastic. So
wonderful.
But talk about the early detection and how important and crucial it is.
Sure. Well, just like, your experience, it's important to be aware of your breast, to be able to notice if you have any changes. So skin changes, if you feel a mass, if you have any nipple discharge, or if they just look different, so sometimes there can be pulling, the nipple can become inverted. So it's just important that women, and men and their partners are aware of what the breasts, look like baseline, and then if there are any changes, to make sure to go to your doctor and get checked out, because we are finding cancer earlier and earlier, unfortunately.
And these are things that it's not easy to contend with. It's something that can bring a lot of dread, but it's important to note that the medical professionals are there, and I'm telling you, it's like miracles that are being performed right now, to where even stage 4 is being considered just a chronic disease. It's no longer that death sentence that it may have been just a handful of years ago.
Yeah, and I think a lot of that has to do with the newer medications. There are medications that are targeted for different diseases in terms of different kinds of breast cancer. So there are different kinds of breast cancer based on the type of cells that are involved. But basically, it's where the cells start growing too fast and in a disordered way. And that's what causes, the mass. But a lot of breast cancer is being picked up, because women are getting their screenings and it's being found in an earlier stage. So that was the case for me. So mine was found at a very early stage, and I was able to, be treated with surgery and radiation. Didn't have to have chemo based on the type of cancer I had, but I myself have been through that, and I know there are members of my family who are going through that now. So I know your journey in terms of your wife's story. But the key again is to make sure to get screened. We want women to start getting screened by age 50, at least once every 2 years. At Aetna Better Health of Illinois, we actually cover screening starting at age 40. And for our members, we will actually give an incentive, a $25 incentive for them to get the mammogram every year, because we know it's so important.
No question. And this is obviously something that you have to talk with your spouse about, and husbands. Don't be afraid to say something if you feel something that's not right. It's extremely important.
Exactly. I also wanted to let your listeners know about an event we're having October 17th on Tuesday at the Salvation Army at 1600 East Clear Lake in Springfield. And that'll be from 10 to 12:30. And so there'll be a lot of information about breast cancer awareness at that event. So we really want folks to come out to get that information. So everyone is welcome.
October 17th, Salvation Army there off of Clear Lake here in Springfield. Be sure to take part in that and get the information you need for yourself, for your loved ones. And note that early detection really does save lives. And it's something that the earlier you can detect this, this, the quicker you can get a diagnosis and then start on
Yep.
those treatments. And those treatments, as Dr. Emory from Aetna Better Health of Illinois highlighting, are revolutionary. And I imagine, Dr. Emory, things are only going to get better when it comes to the treatments for breast cancer.
Yes, that's what we're hoping. And, with more and more research being done on different groups of people, we're finding targeted treatments for people. And again, as long as it's found early, it's a lot easier to treat. So thank you so much for having me and for allowing me to spread the word.
Absolutely. And don't forget about that event, October 17th, at Salvation Army here in Springfield off of Clear Lake. They'll have an event. And what was the time of that event again?
From 10 to 12:30.
All right, so make that happen. Greatly appreciated. To Dr. Emory, Chief Medical Officer at Aetna Better Health of Illinois. Have a great day, all right? We'll talk again, I'm sure, soon.
Thank you. You too. Bye-bye.
It is Springfield's Morning News on 92.7 WMAY, Springfield's news